Good morning, everyone. Hope you're having a great week so far. Stephen Zom here, coming to you with another episode of Tooth Teacher Tuesday. This week, answering probably one of the most commonly asked questions that we get as dentists, and it's a fair question, but question more or less goes something like this, and a little setup, you know, I'm sure many of us can relate to this, but you go in for your regular dental exam and everything feels good to you, but then your dentist tells you that you have a cavity or two. And a lot of times the question that will come from that is, okay, well, do I really have a cavity? Do I need any dental work? If there's a problem, shouldn't I be feeling some pain? If I've got a cavity or infection, shouldn't I be feeling pain? So, because I'm not, do I really need any dental work done? And again, it's a fair question because it would stand to reason that if there's a problem, you, more than anyone else, would notice it. And the simple answer, though, is that a lot of times with dental health related issues, they develop slowly over time. They're progressive and, just little increments at a time. What might seem like simple sensitivity is really a bigger issue going on, that you've just kind of gotten used to the sensitivity over time and don't think about it anymore. Or more so than that, without going into the nitty gritty of dental theory, a lot of dental related issues can be detected before they become painful. And that's kind of the goal, is if we see something ahead of time, the sooner we intervene, the less invasive it is, the less expensive it is, and the better outcome for the future. I would certainly rather catch a cavity while it's tiny and can be fixed with a small filling versus waiting until it starts to hurt, and then at that point could be looking at a root canal or possibly even losing the tooth. And I think this question also comes from just in this day and age, in our modern society, trust is hard to find. And as much as I'd like to think that everyone in dentistry and in healthcare is trustworthy and giving you an honest opinion, sometimes it can be hard to trust your dentists and your doctors, and you put a lot of faith in us that we're giving you an honest opinion, and that can sometimes be hard to trust in when you're not having any pain or other symptoms. So all that to say is, if your dentist is recommending treatment on something, certainly trust your gut. If you feel like you're being taken advantage of, you can always get a second opinion. But again, a lot of dental issues, if we're screening and catching them early, aren't going to cause you any symptoms yet. And the sooner we intervene, the less likely you are to have recurring issues down the road. So, hope that helps. Hope that is useful information to have. And certainly if you have any follow-up questions to that, any comments or thoughts, feel free to comment below. Otherwise, thank you for your time, and I hope you will tune in next Tuesday for another edition of Oral Pathology Corner. Until then, enjoy the rest of your week, and I'll see you soon.